Hello, my name is Mohamed India Malon, a nursing student from Notre Dame of Tacorong College of Nursing. So today I will be performing the assessment of the peripheral vascular system. The first procedure is assess the client's physical and psychological aspect before and during examination. Rationale allows the healthcare provider to gather complete data about the client's health status. Good morning, sir. Kamusta po kayo?
Okay lang po.
Okay lang. Wala po ba nararamdamang sakit sa katawan?
Wala po.
Okay, thank you. Next is review the body areas to be examined. Rationale, helps examiner or the healthcare provider identify which part of the body to be examined systematically. And the next is make a physical and environmental preparation before examination. Rationale, proper preparation of the environment, client, and equipment ensures smooth physical examination with few interruptions. And the next is gather and take the health history of the client, then inquire for any health disease. Rationale, to have comparison with previous illness and present health condition. Sir, meron po ba kayong sakit sa puso o sakit
Wala.
sa dibdib?
Wala po.
Wala po bang history ng diabetes or high blood?
Wala po.
Wala pong lagnat, hindi ginaubo?
Wala po.
Sige, thank you. Next is conduct a physical assessment of the peripheral vascular system using the four skills in assessment, IPPA, inspection, palpation, percussion, and auscultation. Rationale, to assess, determine, and identify abnormal findings in the cardiovascular system. Next is the peripheral pulses. First, palpate the peripheral pulses on the both sides of the client's body individually. For the normal findings, symmetric pulse volumes, full pulsations, abnormal findings, asymmetric volumes, include impaired circulation and the absence of pulsation, indicate arterial spasm or occlusion, and decrease weak, tardy, and pulsations. Okay, so in assessing the pulse of your patients, kasi marami tayong pwedeng i-assess the pulse. Meron dito sa may ulo, temporal, sa carotid pulse, meron din sa brachial, sa may radial pulse, dito sa may tuhod, and dito yung sa kanyang paa. But as for now, ang i-assess lang natin is yung sa kanyang carotid pulse. Okay? So, magpapalpate tayo. If-feel lang natin kung may pulse tayong mararamdaman. Okay? Next is sa kanyang brachial. Okay? Palpate natin kung may pulse tayong mafe-feel. Okay? Normal pulse is 60 to 100. Next is sa kanyang radial. Okay. And i-compare natin doon sa left side. Kasi right and left side ang i-assess natin. So, i-compare natin sa may left side ng pasyente. Okay? Start tayo from carotid pulse. Next, brachial. Okay? And the next sa kanyang radial pulse. Okay. Thank you. The next is inspect the peripheral veins and arms and legs. Inspect the peripheral veins, arms and legs for the presence of older appearance of a superficial veins when limbs are independent and when limbs are elevated. Normal findings: independent position, presence of distension and distension and the nodular bulges of the calves when limbs elevated. So, the veins may appear may appear tortoise and distended in older people. For the abnormal findings, distended veins in the thigh and or lower leg or posterolateral part of the calf and from the knee to ankle. So, ang gagawin lang natin is mag inspect lang tayo. Okay, wala tayong ipapalpate. Inspect natin kung may mga veins na nagbabulge or may lumabas na ugat at, sa kanyang hands. Kung wala naman, that is normal. Kung may lumabas na makikita tayong ugat, that is abnormal. Okay, ganun din dito sa right side. So, inspect lang natin kung may mga ugat na lumabas. Kung wala, that's normal. Same procedure dito sa kanyang paa, sa feet. Okay, check natin kung may mga varicose vein ba na lumabas dito. Kung wala, that's normal. Okay. The next is the assessment of the peripheral leg veins are the sign of phlebitis. Inspect the calves for the redness and swelling over the vein sides. For the normal findings, no redness and swelling. And for the abnormal findings, swelling of one calf or leg or both. So, ganun pa rin. Inspect lang tayo. Okay? Inspect lang natin. Okay? Press lang ng konti. Dito, ganun din. Inspect lang natin. Next is ganun din. Inspect lang. I-press lang ng konti. Push lang ng konti. Ganyan din. Okay. And the next is palpate the calves for the firmness or tension of the muscle. Then presence of edema over the dorsum of the foot and areas of the localized um, warmth. For the normal findings, no edema calves are firm, and for the abnormal findings, warm noted and positive edema in one or both legs. Okay. So, ipapalpate natin ito. So, papalpate ganun lang. Okay. Pag may feel kayo na medyo matigas or masyadong mainit, ibig sabihin there's a problem with your patient. Pero kung wala naman, that is normal. Walang problema ang pasyente. Okay. The next one is firmly dorsiflex the client's foot and supporting the entire leg and extension Human's test or have the person stand or walk. For the normal findings, pain not noted on this dorsiflexion, and for the abnormal findings, pain in calf muscles in forceful dorsiflexion of the foot and positive Human's test. So pag mag-assess tayo ng Human's test ng pasyente, okay, dapat isusupport natin dito para hindi mangalay ang at ating pasyente. Then, slowly push. Okay. Sir, ipupush ko, sir, ha? Okay. So, dahil walang na-feel ang pasyente, hindi siya nag-aray, ibig sabihin, normal ang ating pasyente. Same procedure dito pa rin sa my right side. Okay. Sir, ipupush ko, sir. Okay. So, ibig sabihin, walang problema ang ating pasyente kasi wala siyang na-feel. The next procedure is inspect the skin of the hands and feet for color, temperature, and edema and the skin changes. For the normal findings, skin color pink, and for the abnormal findings, cyanotic venous insufficiency, and mm, increase with limb elevation, then dependent rubor, a dusky red color. Then when limb is uh, lowered. Then for the arterial insufficiency, mm, brown pigmentation around the ankles, arterial or chronic venous insufficiency. Okay. So, ganun pa rin, inspect lang tayo. So, inspect natin yung sa pump. Okay? Then, i-press lang natin ng konti. Pag nagbalik siya agad sa kanyang color, nagiging red ulit, so ibig sabihin normal ang pasyente. Pero pag press natin at matagal, pag white pa rin yung makikita natin, ibig sabihin may problem sa ating pasyente. And the next is the palpate and check for the temperature. For the normal findings, skin temperature warm, not excessively warm, no edema. For the abnormal findings, skin to warm or too cold or too cold. Okay. So, uh, gamit ang ating backhands. So, ito yung gagamitin natin. So, i-feel lang natin. So, dapat warm lang ang kanyang ating mafe-feel. Warm lang, hindi tayo, okay? Hindi yung sobrang init, hindi rin sobrang malamig. And the next is palpate and assess for the adequacy of the arterial flow. For the normal findings, skin return to normal, and the color other, the processing the pain uh, of the hand. For the abnormal findings, delayed returns of um, the color of the skin. Okay? So, ipapalpate natin. Okay? I-press lang natin. Pag-release natin agad, pag bumalik ang kanyang color na red or pink, ibig sabihin normal ang pasyente. Pag palpate natin, nagkulay puti pa rin or parang pale siya, ibig sabihin may problem sa ating pasyente. Okay. The next is the press at least a nail on the each hand and foot, and sufficiency to cause a balancing about 5 seconds. For the normal findings, color return immediately less than 2 seconds, and for the abnormal findings, delayed returns for color, then more than 2 seconds arterial insufficiency. Okay? So, pag magpalpate tayo, okay, i-press natin ng 5 seconds, then release. Within 2 seconds, pag bumalik ang kanyang kulay red or kulay pink, ibig sabihin normal ang pasyente. So, lahat, i-press natin ang lahat ng kanyang fingers, ganon. Okay, so dapat kulay red ang color niya within 2 seconds. Pag kulay puti, ibig sabihin pag pale, nagbo-bluish, ibig sabihin may problem ang pasyente. Dito rin sa kanyang foot, okay, i-palpate natin. Pag-release natin, dapat kulay red pa rin siya. Ang makikita natin, hindi siya kulay puti. And for the evaluation, make findings of the health assessment and physical examination done to the client. Rationale, these are important data to convey to the physician to aid diagnosis of the patient. And for the documentation, record and document the report for any pertinent findings during the assessment to appropriate personnel. Rationale to provide accurate data in the care of your client. So as for now, the assessing the peripheral vascular system is complete.